The United States has approved the Pfizer-BioNTech vaccine for children, and this is a major milestone in the country's fight against the pandemic. The age group decided by the White House is 5 to 11. This makes about 28 million U.S. children eligible for vaccine dosage. Remember, the United States is already inoculating children between 12 to 18. The authorization comes after an expert panel at the CDC weighed the risks and the benefits. FDA officials say that the vaccine is 91% effective. While the decision is being hailed, the dosage is a tricky job for drug suppliers as well as doctors because the vaccine dose authorized for the children is a third of the dosage given to adults. What this means is that smaller needles will have to be used and the second jab will be given 3 weeks after the first one. Nevertheless, the rollout comes at a crucial time. The United States has recorded the world's highest COVID-19 related death toll. In the last 2 years, about 750,000 people have lost their lives to the virus. Meanwhile, vaccination records showing that nearly 80% of adults have received at least one jab in the United States, and almost 70% of American adults are fully vaccinated. The country has also been aggressively pushing for booster jab campaign. Despite some parts of the country still experiencing outbreaks, the U.S. has seen a steady decline in nationwide cases, hospitalizations as well as deaths. Even after a high inoculation rate and the fall in cases, the U.S. is marred with vaccine hesitancy. Many parents are still reluctant to get their children vaccinated, and this might become a hurdle in Joe Biden's efforts to boost the vaccination drive. Speaking on vaccinating children, the World Health Organization has said that the need to immunize children is important, but is not the priority as of this moment.
The United States actually just yesterday recommended the use of one of the mRNA vaccines from 5 years onward in a slightly reduced concentration. That's going on. None of these data have been submitted to WHO, so that's, so to say, on the vaccine performance side. The other aspect that needs to be taken into consideration is the need to immunize children. As we know that in children and also in adolescents, the burden of disease is much lower. So from WHO's perspective, at that point in time, the vaccination of children and adolescents, aside specific subpopulations and adolescents with specific conditions that make them very vulnerable, it's not a priority. That is, of course, something that will evolve as the pandemic evolves, as more supply becomes available. But it is not, in the current situation where we are, it's not a public health priority. And again, speaking for WHO, we have not yet reviewed these data.
Let's now take a look at some other countries that are also vaccinating the young population. Cuba is inoculating the youngest age group in the world. Children aged 2 and above are eligible for a shot, followed by China and the UAE that are also inoculating children. Here, the ages being 3 and above. Bahrain and Chile have also extended their vaccination drives to those as young as 5-year-old. The UK, France, Spain, Germany, Sweden and Canada have decided to only vaccinate children above the 12 years age group. Some Asian countries like Singapore, Japan, even the Philippines deciding on a similar authorization. Oceanic nations New Zealand and Australia are following the same path. At the moment, Israel is administering vaccines to children aged 12 and above, but Prime Minister Naftali Bennett is slated to meet with top health officials. The meeting is set to decide the approval of the Pfizer vaccine for children aged 5 to 11. The vaccination drive in India has not been extended to children so far. So as the government slowly reopens the schools, unvaccinated children are returning to classrooms. It is being closely monitored when the Indian government will conclude the trial and start vaccinating the young population. For more perspectives, with us on the broadcast is the Professor of Public Health at the University of Haifa, Dr. Manfred S Green, joining us from Jerusalem. Thanks very much for speaking with us. In Israel, more than half of those over 12 years old and some younger children have had a single dose of a COVID-19 vaccine. What would you like to say to the parents who are concerned about the side effects of the vaccine, if any, on the children?
So far, it's been, good. In fact, it seems to be a safe vaccine, and we haven't had any major side effects. We have had a few cases of myocarditis, almost all in males, but they have all been mild cases, and they've all recovered well from them.
And what has been the result of vaccination of children in terms of antibody responses?
We don't actually have good monitoring at the moment of the antibody response. We are monitoring, but I don't know of any results, definitely amongst children. In adults, it's been very good.
Just for better understanding, for health professionals and the governments, do you think that giving the nod for a vaccine is far more complex than for adults, as even a small number of adverse reactions to the vaccine can make it harder to justify the vaccine usage?
Generally, we've had a very good response from healthcare workers. A very high percentage of healthcare workers have been vaccinated, and they have been very positive about the vaccine. In fact, healthcare workers the percent of healthcare workers being vaccinated is higher than in the general population.
And the rise of the new contagious variants also showing that the pandemic is not over yet. Do you think that once vaccinated, it is perfectly all right to send children back to school?
I think that we have to be cautious, but it's very important for the children to go back to school. And it seems now that if they get their vaccines and at least 2 shots, and maybe at a later stage we may have to give them a booster, that's going to be pretty effective for the variants that, at least the variants that we know about today. But it's really very important to get the children back to school. So we need to do everything we can to get them vaccinated and get them back to school.
Dr. Manfred, appreciate your sharing those perspectives. Also with us is Dr. Julian Tang, an Honorary Associate Professor at the University of Leicester and a clinical virologist, joining us on the broadcast from Leicester, UK. As countries around the world are now focusing on vaccination for children, what would you like to tell those who are worried about the negative impact, the side effects, if at all, on the children?
Well, children get vaccinated against viruses all the time. Rotavirus, hepatitis B, polio, measles, mumps, rubella. All vaccines have some minor side effects, but for children, these minor effects are much more benign, safer than the actual disease itself. That's why the vaccines in children work so well, because the disease is more severe than the vaccine. And the same as can be said for COVID as well. Children can get very sick with COVID. They can get long-term complications like long COVID. And the vaccination of children also prevents the virus from transmitting or causing severe disease in others. The Delta variant can transmit actually quite well between vaccinated individuals. But once you're vaccinated, the risk of an infected person developing severe disease is much lower. And that's going to be the same for children as well.
There is a specific concern among the parents of 5 to 11-year-olds over whether the vaccines can negatively impact fertility and puberty. What is your message to such parents?
Well, those with comorbidities can be prioritized initially, but you need to vaccinate all the children to protect all the children. Because if you have those who are vulnerable, who may not make a very good immune response, exposed to other children at school or other social activities, even the healthy kids can get infected and transmit the virus to those who are less healthy, who may get more severe disease. So you have to vaccinate all the kids to protect all the kids, including those who are most vulnerable. And that's why we vaccinate all children with the other vaccines, measles, mumps, rubella, hepatitis B, polio, rotavirus, influenza, etc. Because you can't just pick certain kids because those kids mix with other kids, and if they haven't been vaccinated, the other kids may spread the infection, particularly in those vulnerable kids who don't respond very well to vaccination.
There is also an opinion that healthy children should not be vaccinated and rather those with comorbidities should be vaccinated first. What is your view on this?
Well, it depends on the vaccination and the vaccination trial that was used to authorize the vaccine. Generally, if you have small children, the vaccine dosage might be less than for adults, but that depends on the vaccine and whether it's inactivated or live vaccine as well. So I can't say without, refer to a specific vaccine.
Also, are the vaccines that are given to children different from those given to adults, or are they the same? Is it a diluted version? That's also one concern that has been raised.
Well, they probably just tried to correlate it and relate it to their current immunization practices in those countries. So it may well be more of an administration issue than anything else. So the US has started this kind of trend with the 12 to 15-year-olds, leaving the 16 to 17-year-olds in the kind of older teenage group, over 18 and over adults per se. Some people might decide to split that in a different way. Now the US has authorized the vaccine for 5 to 11-year-olds. In the UK, we actually vaccinate primary school children and secondary school children between the ages of 4 and 17 with the seasonal flu virus vaccine. So different countries do slightly different things based on their existing framework.
Thanks very much for sharing those perspectives and the concerns that have been raised by the parents of the children also being responded to there. Thanks very much.